This slide series is done in memory of Dr. Edward Ross Ritvo, who passed away in June of 2020 at the age of 90 years. A pioneer in autism research, he led the field in establishing that autism was neurobiologically based. A graduate of Harvard and a U.S. Army veteran, he spent his entire academic professional career at UCLA. His work included studies of diagnosis and classification, genetics and epidemiology, as well as neurobiology and psychopharmacology. He trained generations of leaders in the field and is survived by family members and many, many students. It's an honor to dedicate this series of talks to his memory with the support of Dr. Ariella Riva Ritvo Slifka and the Alan B. Slifka Foundation.
Hello, and welcome to the Center of Excellence on Autism Spectrum Disorders at Southern Connecticut State University's Professional Educator Training Series. This video is on the importance of consistency in autism supports. My name is Dr. Meghan Brahm. I'm a board-certified behavior analyst and assistant professor at Southern, as well as a center team member. The objectives or the goals for today's presentation is to start to understand the importance of consistency in individual supports for people with autism in school settings. We're going to start to understand threats to consistency, and we're going to start to understand how we can increase consistency when decreasing those threats, particularly in school environments. Some terminology to start. When we talk about consistency, what we're referring to is an unchanging follow-through on established policies, procedures, routines, outcomes, expectations, etc. We are also going to talk about intermittent reinforcement today. So intermittent reinforcement refers to a type of reinforcement, or what we call a schedule of reinforcement, by which some behavior, but not all instances of behavior, are reinforced. That will make more sense in a little bit. So back to consistency. When we talk about the unchanging follow-through on established policies, routines, outcomes, expectations, procedures, or whatever it may be, we really think about the fact that we are unwavering in our outcome or our expectation. We are sticking to what's been prescribed, and we're not veering off from that thing. It means that the individuals that we're working with are able to predict events and predict expectations in their environment, which is exceptionally critical when thinking about daily routines and interventions of any and all type for our students with autism in schools. Relative to autism or individuals with autism spectrum disorder, we need to remember that one of the pillars of a diagnosis of autism is the presence of restricted or repetitive patterns of behaviors, interests, or activities. So often this pillar is manifested in what may be seen or referred to as the insistence for sameness, or the inflexibility surrounding routines. I'm sure we can think of instances or individuals who may manifest a restricted or repetitive pattern of behavior when they are particularly considering their routines or inflexibility surrounding routines. Now, it might sound counterintuitive, but in fact, when consistency in the supports for such behavior patterns are implemented, we can actually increase flexibility by being consistent. We're going to talk more about that as we go. One of the major considerations as it relates to consistency is the concept of predictability. So predictability for individuals with ASD is important because it assists in decreasing challenging behavior and increasing success overall, which is of course the ultimate goal. Consistency can really help to organize what can otherwise be a very confusing or very unpredictable world, which directly relates to decreasing challenging behavior and increasing success. And consistent routines and expectations really help to create a more safe, less stressful day for everyone, which of course is a great goal to have. We need to consider the fact that interventions are dynamic and they have multiple moving parts that all occur at once. And we also need to consider the fact that the success of an intervention is dependent on whether or not all of those moving parts are implemented consistently and accurately. So what that means is any and all individuals that are on a team or implementing interventions and supports must be doing so in the way by which those interventions and supports were designed. So that means family members, paraprofessionals, general education teachers, special education teachers, and any other individual who may be on a person's team be implementing the same thing in the same way. That is critically important or vital to the success of an intervention. Some of the benefits to consistency or being consistent with an intervention or with a support is a decrease in challenging behavior, a decrease in power struggles, an increase in adaptability, an increase in flexibility, an increase in the adaptability to change in particular. So we often know that individuals with autism may have difficulty surrounding changes, but in fact, consistency can help with that. Some of the barriers that come up in a person's behavioral repertoire when things are inconsistent, or the barriers to success when inconsistency is present, is an increase in challenging behavior, an increase in what's often termed as non-compliant behavior, an increase in power struggles, and an overall inflexibility or more difficult day for that individual. So today we're going to talk about a number of factors that influence consistency and how we can help those things. So we are going to talk about fidelity, often referred to as integrity as well, intermittent reinforcement, training, drift, bias, and philosophical differences. Let's start with fidelity. Fidelity refers to the extent to which an intervention is implemented the way it was designed to be implemented. So what that means is a wordy way of saying, is this intervention being conducted the way it was supposed to be? Is the design of the intervention being implemented with fidelity, is how we would say that. Implementation fidelity specifically refers to whether or not an intervention is implemented the way it was written or the way it was designed to be. Fidelity is a major indicator of intervention quality. So if we're looking for quality intervention, which of course we all are, ensuring that fidelity is adhered to is one of the indicators that we can use to assess the quality of the intervention. Fidelity is a significant impact or has a significant impact on the outcome of an intervention. If fidelity is not upheld or interventions are implemented in ways in which they were not designed or they're not adhered to in their design, we cannot predict that an intervention or a support is going to be successful. So we really need to be paying attention to the amount of fidelity or how much fidelity is being engaged in with regard to intervention. Additionally, fidelity is very hard to achieve. It's very hard, especially in educational settings. But one of the things that we can do to help fidelity is really ensure that there is appropriate time and training dedicated to the staff or the individuals who are going to be implementing a particular intervention. We're going to talk about training a little bit more in a minute, but for now, let's talk about intermittent reinforcement, that terminology that we brought up at the beginning. So let's remember, intermittent reinforcement is a type of reinforcement, or we call it a schedule of reinforcement, where some but not all instances of behavior are reinforced. If you see the picture on the right, we see the picture of a back of a person's head who is sitting at a slot machine. And so gambling is an often used example when describing intermittent reinforcement. And it's often used because intermittent reinforcement is actually the way in which gambling continues to occur. So if we think about the process that happens when we sit down at a slot machine, or we roll the dice at a table, or we put it all down on red, what is happening is that our behavior in the past has accessed intermittent reinforcement, meaning sometimes pulling the lever on that slot machine has led to us winning. Sometimes it has not. But we don't know when we are going to win and when we are not. The house may know, but we don't. And so what happens is over time, we are accessing reinforcement, or we're winning every so often. And so not knowing and accessing that reinforcement every so often leads to a maintenance of our gambling behavior over time. And unfortunately, that's how things like gambling addiction come to be. So Understanding intermittent reinforcement is both very useful and both very problematic in school settings, because intermittent reinforcement can lead to a persistence in useful behavior over time as well as problematic behavior over time. So, understanding that intermittent reinforcement is the single most effective way to maintain behavior over time is critically important to consistency, because intermittent reinforcement often in a school team means that an individual or multiple individuals are not being consistent with a designed intervention. So that means that an individual is accessing reinforcement sometimes, but not all the time. And so we know that behavior is then going to persist over time. Again, that can be great for things like skills or academics, and it can be really problematic for things like challenging behavior. So we know it is a law of behavior that behavior which is reinforced only sometimes or only a little bit will absolutely continue to persist. So back to training. Training is a very, very critical component of any intervention and the consistency of interventions like we talked about. So training individuals to implement interventions with students with autism is absolutely key to any educational program. And it ensures that that intermittent reinforcement is not going to become problematic. However, training is also one of the largest barriers to success that we see in educational settings. Educational settings are already very strapped for time. They are very dynamic environments, and it is often very challenging to get the amount of training time that is required to gain fidelity in certain implementations. We know that practice, and most of the practices that we use in education, take many, many, many hours to achieve mastery. So for example, pivotal response training, which is often used in school settings, can take anywhere from 8 to 20 hours to achieve mastery in its implementation. So we need to understand that a specifically designed training and time for which is so important to intervention, or intervention's unlikely to succeed. Now, there are things that we need to have in place for a successful training program. So we need a clearly defined procedure, we need time, and we need practice, and we need checks to ensure that the implementation of interventions or supports are existing the way they are supposed to over time. One of the ways that we would start a training procedure is that concept of a clearly defined intervention protocol. This is often found in a protocol manual or an intervention manual. So we need to be sure that we have a very thoroughly written procedure, which includes troubleshooting. So what happens when things go wrong, because they will go wrong. We also need to think about what we need to provide in terms of time for the individual who's being trained on a procedure or how to implement a procedure. We need to give them enough time to read the procedure, read the manual, and they need time for discussion and review with the individual who's doing the training. We need to ensure that written procedures are readily available for reference in whatever environment procedures or interventions may be implemented. So they should be readily available, maybe up on a classroom wall or on a clipboard or whatever other useful tactic your classroom may have. The other consideration, though, is a training manual is nowhere near enough. Reading a training manual and discussing the steps in a training manual will not lead to fidelity and consistency. There's much more that needs to be done. We need some sort of procedure by which an individual can be trained to implement an intervention. One of the ways that we can do this is behavior skills training. So behavior skills training is an evidence-based way by which we teach people to engage in particular practices. So there are 4 overarching steps in a behavior skills training procedure. The first is with reference to that defined training manual. So we need a written procedure in order to understand what needs to happen. We have that written procedure. We give the individual time, the individual who's being trained, time to read that procedure and to discuss that procedure with the trainer. And then we have a modeling opportunity. So modeling refers to the person who's designing the intervention and who's ultimately responsible for the intervention, showing the person who's being trained how to do the steps that are involved. So the trainer models the intervention. Then the trainee or the person learning the intervention has an opportunity for rehearsal. So that's a chance to practice the implementation of an intervention. And then at the end, they have an opportunity for feedback. So they get some sort of reinforcement. They're explaining what is going well or what may need to be changed in terms of corrective feedback. So behavior skills training is a very useful model for a training to implement any sort of intervention in a school. So training should be data-driven, meaning that we need to be collecting data on a person's implementation of any sort of intervention in order to make a decision on whether or not they are ready to implement that intervention on their own. So that requires observation, data collection, and feedback with regard to the amount of success a person is having in the fidelity and consistency of the implementation of an intervention. So the extent to which a person is ready to implement an intervention should be specifically based on data, not on the fact that they have moved through the steps that we've previously talked about, like reading the manual, having an opportunity for modeling, rehearsing, and feedback. But rather, there should be data that support all of those steps and say that this individual has met mastery in the implementation of a particular intervention, and they are now ready to go implement that intervention in the applied setting or in the classroom. Data should also be used for monitoring and checks. So that means we need to continuously take data to ensure that fidelity and consistency is being upheld. So we should be taking implementation fidelity data on a regular basis or a semi-regular basis. But in particular, data should be collected if an intervention is not having its intended effects. So we need to do something called a fidelity check, and that is a data collection process by which we check to see whether or not an intervention is being implemented with fidelity. Again, a database decision. 3 additional factors that influence the consistency of interventions are the concepts of drift, bias, and philosophical differences. So drift directly relates to the implementation fidelity that we discussed, and drift is the phenomena of people naturally moving away from the intricacies with which implementation is dependent on. So it's sort of a drift away from the way that any sort of intervention was designed to be implemented. It happens quite often, but that is the point of fidelity checks. The next bias and philosophical differences are very interrelated, but they refer to the fact that an individual might come to an intervention or to an implementation with a preconceived notion or with a difference of opinion. And so that bias or that difference of opinion can inadvertently sabotage different types of interventions if the person engaging in the intervention or the implementation of an intervention doesn't, quote, what we usually say is buy into that intervention, or may have a difference in their opinion on which intervention should be used. So those are things that we really want to try and work out before we're implementing an intervention. We should get buy-in, and we should ensure that all individuals' philosophical standpoints on a team are heard and respected and discussed before we're designing an intervention. Let's talk about a case study. Let's say we have Tim. Tim is a 12-year-old male in a self-contained autism classroom. At the beginning of the school year, Tim had presented with some challenges surrounding transition. So he had engaged in some challenging behaviors surrounding transition opportunities during his school day. So accordingly, a system was put into place where Tim was supported in his transitions. So Tim was provided with 5 and 1 minute warnings when transitions were coming. A timer sounded at the instance of a transition, and then he was provided with a visual schedule which told him what was next in his day. However, recently, Tim's challenging behaviors during transition have been increasing. The team is unsure why his challenging behavior has been increasing again, and so they have decided to observe transitions for 1 week to get a better understanding of exactly what is happening with Tim's increase in challenging behavior. Here we have the fidelity check data. So remember, when we talked about fidelity checks, we're talking about the breakdown of the manual understanding all of the steps that are embedded in the training manual and therefore embedded in the implementation of a specific intervention. And we are ensuring that an individual is adhering to all of those steps of an intervention. And so what we have here is Tim's fidelity check data. So let's pretend this is data on, let's say, Tim's paraprofessional and her or his implementation of Tim's procedure or support around transitions. So what we have are all of the supports that I've put in place broken down on the left where we see the procedure column. So we have the 5-minute warning, the 1-minute warning, the timer being signaled, Tim being prompted to check his visual schedule, changing the target on his visual schedule, and then moving to that next activity. In the next column, we have 5 separate dates. So that is Monday through Friday of a school week. And we have data below those dates on all of the different steps of the intervention. So the pluses in the data column represent when the piece of the intervention was implemented correctly or with fidelity, and the minuses represent instances where the procedure was implemented incorrectly or without fidelity. So what we can see is the first column, we have 1, 2, 3, 4 instances or 4 components of the procedure being implemented correctly to incorrectly. If we look in the next date, the Tuesday, we have 1, 2, 3, 4, 5 pluses, which means that 5 steps were implemented correctly, but the 1-minute transition was not. In the next column, again, we see that the 1-minute transition was not implemented correctly and the timer was not signaled. Then on Thursday, we can see that the first 3 steps of the intervention were implemented correctly, but prompting Tim to check his schedule and changing the activity that was present on his schedule was not adhered to. And on Friday, we can see the same issues occurred. So what we can get from this data is an understanding of where the procedure breakdown is coming and why Tim's challenging behavior may be increasing. Obviously, this data does not definitively tell us that this is why his behavior is increasing, but it gives us a very good starting point in order to change what we as the adults are doing to ensure that Tim has the best opportunity for success. So now, on the next Monday of school, the individual who's responsible for this intervention can assist the paraprofessional in regaining their consistency and regaining their fidelity to this intervention. So we can ensure that the paraprofessional's behavior is changed, again, to increase fidelity and increase consistency, and ultimately to support Tim, which is what everyone's goal should be. So we know the team found that the transition procedure was not being followed consistently. Tim's previous successes had decreased because of a drift from the protocol. Remember, we talked about drift being one of the barriers to consistency. And so it led to what we call a resurgence of challenging behavior. And the team is now going to work to implement fidelity and create a more consistent data-based fading plan to get rid of the procedure which was put in place, as the data tells us is appropriate. Some take-homes about consistency is that it is key in any intervention. Even if just one person on the rare occasion does not follow the plan to the extent it was designed, we can see intermittent reinforcement and we can expect behavior to persist over time. Training is a vital component to consistency. Without adequate training, without database training, do not expect a program to be implemented with consistency or fidelity. Intermittent reinforcement can be hiding anywhere, so we need to find threats to consistency in intermittent reinforcement, and we need to try and decrease those things. And we need to be sure to have a very clear plan for fading interventions, or we run the risk of increasing drift, because typically what happens is as behavior begins to get better, as we say, or as behavior begins to change, the people who are implementing interventions take a natural drift away from the structured intervention because it's working. But that's not actually how it's designed. Interventions need to have a very clear plan for fading and for drifting away, or else we run the risk of drifting or veering away from the intervention too quickly or not in the appropriate way, and then seeing that resurgence of behavior that we talked about. To learn more on some of the topics that were mentioned in this video, please reference the other video series trainings on Introduction to Learning, which is Presentation 2, Challenging Behavior, Presentation 11, Executive Functioning, which is Presentation 14, and Implementation of IEPs, which is Presentation 19. Thank you so much for listening. To learn more about our Autism Center, please visit our website. And to consider supporting our Autism Center, your contributions can be made through the bit.ly link below. Here are some additional references should you choose to read more on the topic.